What is AFP's role after liver cancer treatment? Imagine a tiny protein that can tell us a lot about how liver cancer is doing after treatment. That protein is called alpha-fetoprotein, or AFP. It's made by the liver and the yolk sac during fetal development, but in healthy adults, AFP levels are usually very low. When AFP levels are high, it can be a sign of liver cancer, especially hepatocellular carcinoma, which is the most common type of primary liver cancer. Doctors often measure AFP because it helps them understand how well treatment is working and if the cancer might come back. After a patient undergoes treatment like surgery, chemotherapy, or immunotherapy, AFP levels are closely watched. If AFP drops significantly, usually by 20% or more, it often means the treatment is working well and the patient has a better chance of recovery. On the other hand, if AFP levels stay high or don't decrease enough, it could mean the cancer is still active or has come back. This is why regular AFP testing is so important in follow-up care. Another key role of AFP is early detection of recurrence. Sometimes, the cancer can come back before it shows up on scans or causes symptoms. When AFP levels start to rise again during follow-up visits, it can alert doctors to investigate further. This early warning can lead to earlier intervention, which might improve the patient's chances of successful treatment. Monitoring AFP levels also helps guide how doctors manage the patient's ongoing care. For example, if AFP levels don't decrease as expected after surgery, the medical team might decide to do more frequent imaging or consider additional treatments. The trend of AFP levels over time provides valuable information that complements imaging tests and clinical examinations. Research shows that how quickly AFP levels decline after treatment can predict outcomes. For instance, a daily decrease of around 9% in AFP levels has been linked to longer survival and lower chances of the cancer returning. Including AFP trends in staging systems helps doctors better understand each patient's risk and tailor their follow-up plans accordingly. It's also worth noting that AFP isn't perfect. Some liver cancers do not produce much AFP, so a normal AFP level doesn't always mean there is no cancer. Additionally, other liver conditions like hepatitis or cirrhosis can sometimes cause elevated AFP levels. That's why AFP testing is always used alongside imaging studies and clinical assessments for a complete picture. Beyond its role as a marker, AFP is also being studied as a target for new therapies. Researchers are exploring ways to develop treatments that specifically target AFP or its pathways, aiming to improve outcomes for patients with liver cancer. In summary, AFP plays a vital role after liver cancer treatment by helping monitor how well the treatment worked, detecting early signs of recurrence, and providing prognostic information. Its levels and changes over time give doctors important clues, but they always consider AFP results along with other tests. If you or someone you know is managing liver cancer, it's essential to work closely with healthcare professionals who can interpret AFP levels in the context of the overall health and treatment plan. Always remember, individual cases vary and personalized medical advice is key to the best outcomes.